Hi everyone, you're listening to the Health and Wellbeing podcast. I'm Alison Mitchell, a practicing naturopath, and you can find me on naturopathnsw.com.au. These podcasts will feature discussions on various health conditions, health tips and nutrition from a naturopathic perspective. Sometimes it's just me, sometimes I'm interviewing guests. All the time I hope to share with you information on health and wellbeing with the aim to empower and educate. Please remember that all information is general and not a specific recommendation that replaces consulting with a practitioner. Please talk to your healthcare practitioner before undertaking any changes to your treatment regime. Everyone, thanks for joining us again today for part 2 of the Adrenal Fatigue podcast. So last time we talked all about the causes of adrenal fatigue, and today we're going to be talking about the things that you can actually do to help manage it. So we're going to be talking about diet, we're going to be talking about lifestyle, we're going to be talking about herbs and supplements as well. Just a disclaimer though, remember that it is important to actually see a practitioner if you do just suspect that you have anything going on. But hopefully this information that we're going to talk about today is just going to give you a little bit of a guide in the right direction. How are you going, Lisa?
I'm good, thanks, Alison. How are you?
Yeah, good, thank you. Doing well. So almost at the end of the pregnancy now. So by the time this comes out, I'll have been well and truly popped.
Excellent. I bet you're looking forward to that.
Yeah, definitely. Can't wait to meet him.
Oh, boy, lovely.
Yeah, it's a boy. Yeah. And so I guess if anyone was listening last time, they found out that you like to really work with people with thyroid problems and adrenal fatigue. That's
right.
That's your thing. So I'm really excited to actually do to help it. So what would be the typical sort of situation where someone comes to you and you suspect that they've got adrenal fatigue? So as based on last time, you've sent them off for a cortisol test, and then it comes back as a few different situations. So where would we go from there?
Okay, so the treatment is dependent upon what stage of adrenal fatigue they come back with. So stage 1, stage 2 and stage 3, the treatment protocol around these different stages is quite different, which is why it's such a good idea to test. So stage 1, we're usually seeing, remember, high cortisol and high DHEA. And stage 2, we might see normal cortisol or high cortisol and then normal DHEA or high DHEA. And then stage 3, we're seeing low cortisol and low DHEA. So obviously the treatment's going to be different. If someone's got high cortisol, you're going to treat them with different herbs and different nutrients compared with if they've got really low cortisol, because, we want to do 2 different things there.
Okay. And then what about the lifestyle techniques? Do you do that differently for each stage as
well?
well?
Even the lifestyle techniques are quite different, particularly when it comes to exercise. People who have stage 1 adrenal fatigue, because they have high cortisol, they can usually get away with doing more. But stage 3 adrenal fatigue, these people really shouldn't be out there doing a lot of cardiovascular exercise, so boxing and marathons and training for fun runs and things like that. They're just depleting themselves further. So even my recommendations around exercise are quite different. And often with a stage 3 adrenal fatigue person, I will say don't exercise, even though it's contrary to what we're told, and they might say, oh, but I feel so lazy if I don't exercise. Their body's actually going to heal a lot better if they rein it in a little bit and give it a bit more time to rest and rejuvenate. And often the weight will come off with these people because sometimes they have difficulty losing weight and they say, oh my gosh, really, I don't have to exercise and I'm still losing weight. It's great.
These people might have been exercising a couple of hours a day in order to try and lose the weight. But once you sort of get that out of the system and the adrenals start to feel a bit better, then the hormones get better and the weight comes off.
That's right. And these people also like to do exercise. They can be a little bit addicted to exercise because exercise, as we know, stresses out our body and it increases our cortisol. So when we exercise, our cortisol is higher. So if you're adrenally fatigued due to that increase in cortisol, you temporarily feel quite good because you're stressing your body out. But it's then afterwards, so later on that day or the day after, that they feel really depleted and exhausted, and that's because they've pushed their body more than it can take, and it can't maintain that So if you're not feeling great after doing exercise, if you're feeling really tired and fatigued, of course it's normal to feel a little bit tired and fatigued, but if it's, have to sit on the couch all day or have to lie in bed and can't get up in the morning, then you know that your body just can't handle that at the moment, and it's better for you, if you're in a stage 3 adrenal fatigue person, to be doing something like a gentle walk, maybe 20 minutes in the sun, not fast paced, just at a nice rate, or doing something like Pilates or yoga, which is just a little bit less stressful to the body. Whereas stage 1, you probably still can go for a bit of a run or do something like that.
Yeah, and what I find as well is that a lot of these people who are fatigued sort of feel like they're being lazy, but you're not tired, and then that's not because you were lazy in the first place, it's because you were the opposite.
Exactly, that's right.
Whereas there can be the complete opposite side of things, where like people who are under exercising can then have a depletion of the mitochondrial cells and then increase like obesity as a result of that, which causes adrenal fatigue on its own right. So you've got like you need to strike that balance and do what feels good, I think, is the key. So for people who are not exercising enough, then that can be a problem, and similarly over-exercise can definitely be a problem. So I think that just as a general rule, like if you are still like you said before, like if you're still tired after about 20 minutes or so, then you might have been pushing yourself a little bit too far.
And I think it's important for us to listen to our body and listen to the cues that it gives us, because often people bypass that information and they go with, but the doctor said I should be exercising, so that's what I should do, not looking at what specific types of exercise and what sort of timing is appropriate for them. So listen to the cues that your body is giving you. If you're feeling tired, it's a sign that, it doesn't want you to go out and try and walk or go on the treadmill for 45 minutes or do some aerobic style exercise. Listen to your body, and it gives us the right messages often.
The most common situation I see in people who are over exercising is people who are doing CrossFit really intensely, and also people who are doing marathon running and
But they need a couple of coffees before they start to get going. That's a sign that, if you need a performance enhancer, then maybe things aren't quite right.
Yeah, it might be a little sign. Yeah.
Not that I don't like a coffee myself, but
No.
if you're reliant on it to, a couple of coffees before you can actually do that exercise, then, you're probably pushing yourself further than your body can do.
Yep. So I think for the really long intensity ones as well, the other thing with that is that they seem to be pushing themselves throughout the whole year. Like they don't seem to have the seasons. And so like when we're looking at supporting people who do actually have a specific event to work up to and things like that, we can use herbs to reduce the burnout experience with the exercise. But when it's a constant thing, then that's when your body's going to suffer from that. So I think reevaluating your form of exercise and doing a bit more gentle stuff incorporated throughout it as well, and rethinking the hours. So everyone's different as well. So you've got some people who have just got that stamina and that constitution where they can great for them, but we've got as if they're not like that ourselves. And so just noticing how you feel, and then getting a fluctuation throughout the year in the intensity of the exercise, and a variety of types of exercise, including some weight training to build up your muscles, and then some flexibility training that's a little bit more sort of slower pace, like yoga and Pilates, and then your cardio can be a bit of a variety of things. But I think also doing something that's fun. If you feel like you're pushing, that's an emotional stress as well.
Yeah, that's right. But back to what you were saying, though, I'm a huge fan of strength training. I think that it's really valuable, particularly for people who have stage 3 adrenal fatigue. Gives a really good all-body workout and often gives you the same results, if not better, than doing aerobic style exercise. So I think it's important to remember, back in the Paleolithic days, we wouldn't have been running on a treadmill for 45 minutes looking at someone else's bum in front of us. We wouldn't have been doing things like that, but we would have been trying to lift heavy things to build ourselves,
And not
cover and all that sort of stuff.
yeah,
Trying to lift and wash clothes
functional.
and hands.
Yeah.
Yeah, functional, exactly.
Yeah, and I think that's the benefit of actually getting the weight training in, like when you're doing it from a functional perspective, instead of just doing a bicep curl, you might be doing a burpee or a pull-up, something along those lines, which is actually using your whole body, and you're going to get a lot more benefit and bang for your buck, so to speak.
That's
Yeah.
right. Yeah.
And with the stage 3 people, I do find that doing the weight training, but doing a slower paced weight training in the morning is quite helpful for boosting the HCG hormone, which just helps with that recovery and repair. So I usually do recommend that people do weights in the morning when they're in that sort of chronic fatigue sort of stage of that situation.
Absolutely, and I think also work with a trainer who knows what they're doing in relation to that, not someone that has no idea about adrenal fatigue and just wants to flog the patient and get them to run as fast as you can for X amount of time and exhaust them, because that's not what it's about when you've got adrenal fatigue. Your body can't handle that. So work with somebody that knows what they're doing.
There's a really good trainer that I work with sometimes, and he's fantastic because he can sort of recognize when that's happening, and so he'll get them to do a burst of something and then to rest and bring your heart rate down, as opposed to when you have someone that doesn't know the situation, they'll just go push, 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 and you don't want that stress.
No.
Also, similarly, the way that they're motivating you, you don't want someone yelling at you in your ear the whole time.
Some people like that. Some people love that style. I don't at all, but I know some people want to be abused at the gym.
I know. Yeah, they've got to have that so that they can do their thing.
That's right.
But I just wonder whether that's good for people with adrenal fatigue or not, to have that added source of stress.
No, I don't think so.
So, all right, awesome. So I think we've really covered everything that we needed to talk about in terms of exercise.
So something else I think is really important to take into account is that often people think stage 3 adrenal fatigue, when we talk about it or when we read about it, that it sounds very all doom and gloom and like the person wouldn't be able to get out of bed and they're dragging themselves around all day. They wouldn't be able to maintain a job or function very well. But actually that's not true at all. I see a lot of stage 3 adrenal fatigue patients, and I've been one myself, and they can actually have quite a high level of functioning. They can, keep their jobs and do really well and still cook and shop and all that sort of stuff. But it's an effort for them, but they can still do that. So just because, if you're able to go about your life and do lots of little things and juggle, it doesn't necessarily mean that you're not a stage 3 adrenally fatigued person. People often surprise themselves, and when they come into the clinic and I talk about this, and they'll say, I don't think I'm a stage 3, I can still do this and that and so on. But then their test results come back and they are actually just really depleted. They are so used to functioning at that level that they don't know any different.
Yeah, I agree, and I think that's how you get that way in the first place, because you do push through, and you're not able to sort of say, I'm feeling a bit tired, I think I should take a break.
Exactly.
And that's when you get to that stage. Yeah, I think that's a really great point. And so many people, when you read about all this information that's out there, people just say, just suck it up, princess. Just sort of, like, you're just tired. It's not that same sort of tired.
That's right.
Yeah, you've got your sleepy tired, or you haven't had a good night's sleep tired, and then you've got adrenal fatigue tired and chronic fatigue tired and all those other things. It's actually something going on, and like don't listen to those people who are trying to tell you that you're in your own head, that it's not you. So in terms of diet, there's a lot that needs to be addressed in that area as well. I feel like, and we've spoken about this in the last episode as well, but one of the key things is keeping your blood sugar levels regular. And the benefit of doing a low blood sugar level diet, a regular blood sugar level diet, is that a lot of the time that fixes everything before you need to go in with some more hardcore interventions. But then it is still important, even if it's not the main cause as well.
Yeah, cortisol plays a really important role in blood sugar regulation, and often just switching to a whole food diet, ensuring that there's plenty of nutrients, plenty of fruit and vegetables for fibre, and some sort of protein at every meal, whether that's vegetable, animal, is really, really helpful. So nutrient diet. For people who have adrenal fatigue, stage 3, I generally suggest, lots of small, frequent meals to keep their blood sugar more stable, not skipping breakfast. There are some people, if we look at them from a constitutional perspective, that can get away with skipping breakfast occasionally. But for stage 3 adrenal fatigue people, they really do need to put something into their system, particularly if they're coffee drinkers. One thing that I see quite frequently is people starting the day with a coffee before putting any food into their, and unfortunately this puts their body straight into sympathetic nervous dominance, because coffee increases our cortisol levels, so we go straight into fight or flight. And for an adrenally fatigued person, that's the opposite to what we want to achieve. So if they still want to have their caffeine, which I do understand, because they're often quite fatigued and tired, I suggest eating something before they have the coffee, and then instead of having maybe a full strength, have a week or something like that, instead of going in there with a double shot, whatever.
Yeah, definitely. And I think the more nutrient dense the food, the better.
That's right. So you can imagine too, having a coffee first thing in the morning and then not eating, you're going to have a massive blood sugar crash, which is going to impact the HPA axis quite dramatically. So,
Yeah,
coffee depletes us also of all those important nutrients, particularly B vitamins, which is so important for adrenal function. So we need to just be really aware of that.
Well, we'll get into nutrients in a second. I think one of the other things in terms of like avoiding trigger foods, so caffeine being one of them, the other thing can be potentially like if you've got a food intolerance or a food allergy, then if you're continuing to eat that sort of food and you recognise that it causes you some issues, then that's going to be placing stress on your nervous system, but it's also going to be creating inflammation. And if you remember from last time, inflammation is a key player in this because of the way that it affects the hypothalamus in that HPA axis dysfunction. So doing an elimination and re-challenge diet can be beneficial, and most of the time people are finding that they're reacting to wheat and dairy and eggs as the most common ones. So if you don't want to do a full-on elimination diet, you could always look at doing that first. And I think that apart from avoiding caffeine, also keeping sugar to a minimum as part of that low GI diet, and just making sure that you're drinking lots and lots of water as well is really important as well. You've also got to get your gut healthy, and so in order to do that, there's the avoiding of the food intolerances, but you might also find that having more fermented foods can be helpful. Fermented foods are beneficial for putting in some good bacteria, so like it's a probiotic rich food, and so that could be things like sauerkraut, kimchi, kefir, kombucha. Bone broth is also something that a lot of people do find helpful, and the benefit of bone broth is that you're getting a broader range of nutrients that you do need for hormone health. When we tend to just be eating like chicken breast and steak all the time rather than having your more gelatinous cuts of meat, the amino acids that we're actually getting from these meat sources is actually going to be more prone to making our thyroid dysfunctional. So we want to be having a nose to tail approach to eating. And seaweed. I love seaweed, in case anyone doesn't know, but that gives you a lot of the minerals that you need for your adrenal function as well.
Fantastic.
So one of the other things that's really important for people with adrenal fatigue and chronic fatigue sort of situation as well is sleep issues. So what might be happening is maybe you're not getting enough, maybe you're not getting the right quality, or maybe you're actually getting too much sleep as well, because too much sleep can be problematic for some people on its own. So for sleep hygiene, some of the things that we want to be thinking about for that is that you want to be making sure that you're not too stimulated before you trying to go to sleep. So that could be avoiding playing on your phone or the computer or using the TV right before you go to bed. And the other aspect with that as well is that the blue light of the TV screen and the computer screen as well actually can interfere with your melatonin hormone. And so then that can be problematic for some people, because then if your melatonin is out, then your cortisol is going to go out as well. But if your cortisol is out, then your melatonin is going to go out as well, because they're antagonists with each other. So what should be happening is cortisol should be high at the start of the day, and it drops down and then makes room for melatonin to then take over. So we make melatonin through our eyes in exposure to light, and so that's getting some sunlight the first thing in the morning, and then when the light is removed by the nighttime coming on and turning off the lights and starting to wind down, then our body gets this sleepy message happening as well. So there are other hormones that are involved as well in sleep. So we actually need to look at it from a melatonin perspective as well as the other sleep hormones. And that's where things like too much caffeine can be affecting our sleep hormones, because that will actually interfere with those sleepy hormones. And so avoiding caffeine and other stimulating foods and drinks after usually around 3 o'clock, but earlier if you're much more susceptible to it, depending on how well you detoxify the caffeine, is worthwhile as well.
So with regards to sleep hygiene, I do think it's nice to have some sort of little routine if you're having difficulty sleeping. So, I have to put my little girl to bed, and I often read her a little story, but I have to obviously put the lights off. Some people sleep with the light on or the computer on or the TV on. I think it's really important, as we've said, to make sure all those things are off so that our eyes adjust to the fact that it is night, and our hormones do too. And then I play her lullabies, and honestly, I put her to bed at 7:30 sometimes, and I'm ready to fall asleep myself because the music is just so relaxing. So I think playing some really nice, relaxing music can be helpful. I also love to recommend to my clients who find it difficult to wind down and have an overactive mind at night to do a guided meditation, some yoga nidra. And that, they may not necessarily fall asleep during the guided meditation, but they'll definitely get their brain into a more relaxed state. So guided meditation tends to be a lot easier than just trying to sit there cross-legged and trying to clear the mind, which is almost impossible, because otherwise we'd be dead if nothing was going on in our head. But the guided meditation just is much easier because someone's telling you what to do. So, feel your toes and relax your fingers gently one by one. I find just is a really nice way to stop that brain that's ruminating a lot. Warm baths, warm showers, having a shower in the dark, even with candles and things like that, can be just a lovely thing. And I guess it just depends on what your cup of tea is, or what your sense is, because for some people it will be that auditory sort of stuff, and then for others it'll be more of the sensory stuff. So they prefer to light candles or burn oils, and that relaxes them and helps them to get to sleep a bit better, or even putting a bit of essential oil on their pillowcase. But I think, continuity is really important, and just it's really about retraining your brain and retraining your body, getting it out of that overstimulation that can occur at night, and that takes time and practice.
Yeah, I like that point. It's retraining your brain. So setting up a routine, almost like you're forming a habit. So this is what I do to wind down, and then bang, you can go off. And everyone will have a bad night's sleep occasionally, so don't let that throw you if that happens. But trying to get it consistent is really good. And a lot of my patients do find that their mind is just racing way too much before they fall asleep, or they wake up at certain times of the night and their mind is racing. So I find personally that having something that I can just write down what I'm thinking and sort of get that done, almost like a tick, can be helpful. But if it's really if it's really bad, then get up and do something about it, and then go back to bed rather than lying there dwelling on it, because otherwise you're just going to stay awake for the rest of the night. So do you want to let's get into more of the specific nutrients.
Okay, well, one of my favourite nutrients to use is vitamin C, of course. High dose, usually about 5,000 milligrams depending on the person. And that's because we just churn through so much vitamin C when we're stressed. So our adrenals really need it, and we need to get it from the diet. We can't make it ourselves. So, good sources of vitamin C, people often think of oranges and things like that, but there's actually, if we're trying to get up to a limit of 5,000 milligrams, there's only about 60 milligrams or under, I think, in an orange. So you need to eat a lot of oranges to get that vitamin C. So better sources of vitamin C include things like kiwi fruits and guava. But I think in the case of when somebody has adrenal fatigue, I do like to use a supplement just to get that therapeutic dose in there.
Yep. And then when you're looking at using vitamin C supplements, do you tend to use any specific type?
Of forms of vitamin C? Not really. Usually maybe like ascorbic acid.
Yeah.
I like to use it in terms of tablets or powders and things like that. I do like to use a powder because I find it's easier to get it in there. So a scoop might have 2.5 grams. So 1 scoop in the morning, 1 scoop at night.
Yep.
Helpful.
I like to have a bit of a blend of different mineral ascorbates. So rather than just ascorbic acid, you can get supplements that contain magnesium ascorbate and potassium ascorbate in there as well. And also the supplements that contain food forms of vitamin C, like cherry and certain other antioxidant-rich herbs and things like that as well. And I love the powders as well because you can sort of really target your dose, because what a lot of people find as well is that they do get a tendency to diarrhea, which is that bowel tolerance that a lot of people talk about with vitamin C. And it doesn't mean that it's hurting you or anything, it just means that you've sort of had too much for that point. So to drop it down, reduce the dose and go a little bit slower.
That's right. Magnesium's also a great one for the adrenals as well.
Yep.
And just really, really nourishing and particularly good where there is that stress picture or that inability to cope with things. And do you use a lot of magnesium in your clinic?
I use a lot of magnesium. It's probably one of my favorites, and I would say, like, if vitamin C is your favorite, then magnesium's probably mine. And that can really help with just soothing that nervous system imbalance that's occurring in people. And I find that you've got to be careful with the type of magnesium that you get.
Absolutely.
Yeah. Because a lot of the conventional magnesium supplements that you might find on the shelf are magnesium oxide, which is a heavy form of magnesium, and that can cause diarrhea. And you know what, if you're actually using magnesium for treating constipation, that's great. Whereas if we're using it for stress, then diarrhea is not something that you generally want. Because when you're experiencing diarrhea, you're also experiencing a depletion of a lot of your neurotransmitters. So when you pass a bowel motion and you get this normal rush of dopamine, whereas when you get diarrhea, you release a lot more of it. And so we want to actually reserve and contain our dopamine in people with adrenal fatigue. So going for something like a form similar to like a magnesium citrate or an amino acid chelate or a diglycinate is more beneficial for people with adrenal fatigue, because then it's going to be much more gentle on the digestive system, and it can also be much better absorbed and specific for fatigue as well. Another one that's quite helpful for muscle soreness is magnesium malate, and magnesium orotate is also quite helpful for the heart as well. So if you're experiencing heart-related symptoms with your adrenal fatigue and stress picture, or HPA axis dysfunction, whatever we want to call it, then that can be helpful too.
Yeah. And then I would say my other favourite nutrient to use or complex is a good B complex, and I love the activated Bs.
Definitely.
The Dr. Vera's ones. I find those work beautifully. And again, for stage 3, I might actually do 2 of those, one in the morning and one at lunchtime, just to give them a little bit of an extra kick. Obviously, it's got some of the activated forms of the B vitamins in, so less work for the body to do. And then I like to really work on that B5 as well, because it's so important for for that stress aspect too.
Yeah, definitely, because B5 is the main one that we do need for our adrenal as well. Similarly, vitamin B12, because that helps with cell energy, cell repair. And like you said, with the activated B vitamins, what we're talking about there is things like non-synthetic versions of folic acid. And so a lot of people can actually tolerate that quite well, but there are some people who can't. And so that's
I
something.
think it's 25% of the population that actually have a genetic mutation. So is it 25%?
I'm not sure on the percentage, but it depends.
It's a lot.
There's a lot of different variations in the mutation that you can get, and there's more mutations on top of MTHFR as well that you can experience that affect all of that picture. But it all comes down to getting in the right nutrients from food, and that's a whole food diet.
Absolutely.
And don't eat junk that's going to be depleting your nutrients as well, because if you're eating caffeine, drinking alcohol, eating a lot of sugar, or in excess, then you're going to be depleting the magnesium and your B vitamins and your vitamin C and your zinc in order to process that. I was just, while we're on the topic of vitamin C, I was reading a study the other day where they actually gave people enough vitamin C to actually replete them so that they had sufficient levels, and then they had another group where they didn't do that, and then they stressed both the groups out. And what they found was that if you had enough vitamin C in the first place, then you didn't get stressed out.
Oh, that's interesting.
Yeah. Whereas in the other group, they got stressed out and then they lost all their vitamin C. So you will lose your vitamin C if you're stressed, but not so much if you've got enough to begin with.
I will feel like I need to go out to the kitchen and quickly replenish.
Yeah. So that's a really good insight into why stress affects some people more than others. And so apart from constitution and previous stress exposure, your nutrient status will have a lot to do with it as well.
Absolutely.
I love zinc as well, actually.
Yeah.
Zinc for neurotransmitter production for brain health. So one of the other nutrients that I really love for adrenal fatigue, particularly when there's a high cortisol picture, is something called phosphatidylserine. And this
that's because phosphatidylserine brings down high cortisol.
Yeah, that's right. So when you're looking at using herbs and things like that, you've got to be really careful about which herbs you're actually using in that early stage of high cortisol stress, because what is typically marketed as being an adrenal supplement is only really best suited generally for that later stage, whereas when we do testing and things like that, we can figure out where you're at and then target the supplements according to you. So do you use much phosphatidylserine?
Yeah, I use it a lot for that high cortisol picture, definitely. So anywhere there's high cortisol, I'll give phosphatidylserine to bring it down. Yeah.
And so
say it's high at midday, then I'll give it at 11 o'clock so that hopefully it brings down that midday.
Yeah, in anticipation.
Yeah, that's right. Yeah. I really liked what you said about targeting what stage they're at, because it's so true. Say with those standard formulas, they almost always contain licorice, for example, glycyrrhiza glabra, and we know that licorice increases or it extends the half-life of cortisol in the body. So in somebody who already has really high cortisol levels, who's a stage 1, it's the worst herb to give them, because we don't want to extend the half-life of cortisol in their body. They've already got plenty of it. And similarly, with those formulas, they usually suggest having 1 at breakfast or 2 at breakfast and 2 at dinner. We don't want to extend the half-life of cortisol at night time, at dinner time, because that's when we should be winding down. So, it's quite an art to prescribing, isn't there?
Yeah, definitely. And herbal medicine can really fall prey to that sort of issue, because when you're looking at supplements and things like that, the thing is that licorice will probably have a sentence tagged onto it, like good for the adrenal glands, whereas like there's so much more to learn about herbs. They work. There's such a complex thing, and that's what herbalists and naturopaths do, is they learn that so that they can treat people as an individual.
That's right. Yeah, rather than just treating symptomatically. Absolutely.
All right, well, I guess now would be a good time to move on to herbs for adrenal fatigue, but is there any other nutrients that you wanted to cover?
No, not really.
Okay, great. So licorice we've already covered, and that's licorice is an anti-inflammatory and it helps with the immune system. So in a lot of the time that can be really helpful when there is that inflammation component of adrenal fatigue going on and there's an immune involvement as well. But like we were just saying, you don't particularly want to be using it when there is a high cortisol picture because it is going to be too stimulating, and it may be okay to use in the morning if you've got low cortisol in the morning and high cortisol at night, so that you would want to be tweaking what you're taking at times of the day. Another one that's considered to be an adrenal tonic is Romania. And
That's right.
Romania is a lot less stimulating than licorice. It is more of, I consider it to be a rebuilding, nourishing type of adrenal tonic. And it is also beautiful as an anti-inflammatory as well, which is also something that we need.
Yeah, that's right.
What are some other ones that you love?
What else do I like as an adrenal tonic? Codonopsis is quite nice too. That tends to work really well. Great little adaptogen too. And then talking about adaptogens, even though they're not true adrenal tonics, so they're not working specifically on the adrenals, adaptogen herbs such as rhodiola, withania, Siberian ginseng, herbs like that, Schizandra chinensis too, they help the body adapt to stress. So even though they're not working specifically on the adrenals, because they're helping with that adaptation, they ultimately do help the adrenals out because the body's able to adapt to stress better. So there's not such a heightened stress response. So I usually make a formula with all those types of herbs in it too. And if there's low DHEA, then I might throw in something like tribulus in there too, just to work on that. And that often helps with particularly menopausal, perimenopausal women where their DHEA is low. It helps them improve their libido and just their general vitality.
I love tribulus for that picture, and similarly I find that it can be really helpful for those people who have been overexerting themselves with exercise and are getting the injuries really frequently as well. So adaptogens are fantastic, and I think this goes back to what we were saying last time, is that even though we're saying adrenal fatigue, it's not specifically just the adrenals that are having an issue in people that we usually sort of label with this. It's a really complicated condition that we don't really have a great name for the condition at the moment, but with naturopathic medicine, everyone is treated as an individual. So it's something that it gives people a bit more of a hope, I find, in that, actually I can understand a bit more about what's going on with me. So if you see a good naturopath or herbalist or nutritionist, whoever, then they'll sort of say, all right, well, this is what's actually happening in your case, and then they can target the treatment a bit more. So yeah, we talk about adrenal tonics, but yeah, there's also the adaptogens. Similarly, we also use nervines, which is calming, relaxing herbs that are helping to soothe the nervous system and
very nourishing.
Anxiety. Yeah, really nourishing. There's some that are really specifically nourishing as well. Like we class those herbs as nutritives. So like green oats, for instance, or alfalfa. So that can be really helpful for people who just need building up a little bit more.
Yeah, and so where I use a lot of adaptogens in stage 3 adrenal fatigue, which is that kind of exhaustion and depletion, I use a lot more nervines and anxiolytics in the stage 1 adrenal fatigue because their cortisol levels are so high. They're on high alert all the time. They're prized for attack. There tends to be a lot of anxiety and irritability. Just kind of gently sedating the nervous system using things like passion flower and skullcap, which are a beautiful combination together, just help to take the edge of things and help to bring down the anxiety and help with their sleep, because these are often the people that are finding it really difficult to sleep at night because they're really wired. So yeah, whereas with stage 3 adrenal fatigue, they may not necessarily need that sedation because they're already quite fatigued and sedated, and they really benefit from more of the stimulating or the gently stimulating herbs like rhodiola, for example.
I'm loving holly basil at the moment, and yeah, Tulsi, and it's a beautiful tonic overall, but it's also great for the immune system and reducing inflammation. So it covers so much of those areas that we've identified to be an issue in people with adrenal fatigue.
And you know, taking that into account, the immune system is such an important consideration when managing people who have adrenal fatigue, because typically their secretory IgA is low when they have low cortisol stage 3. Their secretory IgA is really low, and we know that's an immune substance that lines the gut and protects us from, say, parasites and things like that getting into our guts. So often we see with autoimmune conditions, well, what's caused that immune system to become hyperactive and turn on itself? And usually the research shows that there's some sort of stressful trigger, whether that's an emotional stressor or a microbial stressor or an environmental stressor. So working on the adrenals and really nourishing that person really helps to get that dysregulated immune system in check. It's really interesting.
Absolutely. I was reading that paper as well about working on the immune system more with this case with chronic fatigue syndrome. And so herbs that have a balancing effect on the immune system, like echinacea, can be really beneficial in that situation. But certainly treating the gut, every naturopath loves to treat the gut. That's like the staple. But you've got to do both at the same time, because if you just treat the gut without treating the nervous system, then...
Absolutely. Yeah, because often anxiety, say somebody's diarrhea, can be caused by a nervous system disorder. So when they're really anxious, all of a sudden their bowels are hyperstimulated. So, yeah, interesting. So if you nourish the nervous system, then the diarrhea might stop.
Yeah, because we make so much serotonin in our digestive system. So you've got to actually think about it from that perspective as well, rather than just, giving a laxative or the opposite. It's gone from me at the moment, but everyone knows what I mean. All right, well, we're getting close to the end now, so I think we'll say goodbye. So thank you so much for everyone for listening, and thank you, Lisa, for joining us. It's been such a pleasure having you on again, and I think that if anyone wants to get in contact with you, all the information will be on my blog post and on the links as well, but it's Lisa Costa naturopath.com.au, and people can find me on naturopathnsw.com.au. So if you enjoyed what you were listening to today, then please subscribe on iTunes and leave a nice review, and have a great day. And if you do experience any issues, then seek help, because there's so much that can be done for you. Bye everyone.